Okay, thanks everybody for joining us today. We are going to go ahead and get started, but feel free as we go through this presentation to put any questions you have in the chat box, and then we will circle back to them at the end of the presentation.
All right, hello everyone, and welcome to the SDSU Wellness webinar about the new Master Health Volunteer Program. Here's a fun fact for you on this first slide. In 2015, South Dakota ranked number 4 out of 50 states for most volunteering. 35.3% of residents volunteered. That's 23.26 million hours of service in 2015. Now that's pretty amazing, but I believe that we can do better, and especially with help from this brand new program. My name is Cheyenne Roth, a Master Program Development AmeriCorps Vista member helping SDSU Extension with their Master Volunteer programs. I graduated from SDSU in May of 2020 and jumped right into my service year with AmeriCorps. Volunteering is a passion of mine, and I was fortunate enough to get this opportunity to actually help create a volunteer program, which is the program you're learning about today.
And I'm Hope Klein. I'm a health education field specialist with SDSU Extension. And in my time with Extension thus far, I have brought together the Master Food Preserver Volunteer Program to the state alongside with my colleague, Megan Erickson. And I'm pleased to be talking to you today about the Master Health Volunteer Program. So this is a brand new program that we have just opened up to the public, and we have gotten a lot of excitement and interest in the program. So we're happy with all of you that have joined us today to learn a little bit more.
Okay, let's start by discussing why the Master Health Volunteer Program is being created. South Dakota is a large state geographically, and with Extension's regional structure, the staff is not able to reach all communities. Therefore, the Master Health Volunteer Program was created to help expand the reach of evidence-based programs offered through SDSU Extension. In South Dakota, at least 50% of residents' health status is due to lifestyle factors such as not using tobacco, being physically active, maintaining a healthy weight, and good nutrition. So if a person doesn't take care of their health and has an unhealthy lifestyle, is smoking and not exercising or not eating healthy, etc., their health is likely to deteriorate. A Master Health Volunteer can teach others how to improve their health, why it's important, and provide resources to individuals who don't have access. Compared to the rest of the United States, South Dakotans have a higher rate of smoking, obesity, and having no leisure time or physical activity. Through this program, volunteers can have a positive impact on our state and many individuals, and we need your help to improve. SDSU Extension cannot do it alone.
So perhaps you signed up for today's webinar because you were looking for an opportunity to volunteer in public health, or perhaps it's just that you were interested in the Master Health Volunteer Program, learning what it was, and just kind of wanted to join to hear more about it. Either way, we're happy that you're here with us today, and we're excited to share with you more about what this SDSU Extension program has to offer. So it is a community-changing volunteer program that will help South Dakotans not only learn how to facilitate educational programming, but also help them become a master in health knowledge and skills. So the Master Health Volunteer Program targets South Dakotans with an interest in sharing evidence-based programs which target healthy living. In the process of becoming a Master Health Volunteer, SDSU Extension provides training which increases the volunteers' knowledge and skills in health topics, and then volunteers are able to use what they have learned to facilitate Extension educational programming within their communities. So if you're familiar with a Master Gardener or a Master Food Preserver program, which are also offered through SDSU Extension, the Master Health Volunteer Program, it certifies individuals to provide program-specific workshops and educational opportunities for their communities. So when you sign up to become a Master Health Volunteer, you get to choose which area you're most passionate about and pick from one of 5 tracks to become certified in, and then to take that program and to facilitate these programs within your communities. So those programs are listed here on this slide. There is Better Choices, Better Health, Fit and Strong, Growing Healthy Families and Communities, Money Mentors, and Walk with Ease. And we're going to dive a little bit deeper into each of these programs now. So first, we're talking about Walk with Ease and Fit and Strong. These are both of our physical activity evidence-based programs. I'm going to start with an introduction on Walk with Ease. So this is a 6-week walking program that was designed by the Arthritis Foundation for individuals who want to start or continue walking in a safe, education-driven environment. Walk with Ease sessions meet for 3 times a week for approximately 1 hour each session. As a leader of this program, you facilitate each session, engaging participants in a brief educational discussion, warm up, stretching, and then a walking period, and then taking them through a cool down. This program also really helps individuals set their own individualized walking goals and helps them keep accountable to those goals. Now, touching on the Fit and Strong program, this one is an evidence-based falls prevention program that was developed by the University of Chicago, Illinois. This program can be done over either 8 weeks or 12 weeks. If you do over 8 weeks, you meet 3 times a week. And if you do over 12 weeks, you meet twice a week. There are 90 minutes per session, and the first 60 minutes includes exercise. And then the last 30 minutes includes group discussion and health education. And the exercise component, you as the instructor would guide participants through safe stretching practices, balance, aerobic, and strengthening exercises. Then for the 30 minutes of group discussion, there are topics that surround arthritis, exercise components, and even how to incorporate physical activity into one's everyday life. Another unique factor about the Fit and Strong program is that you as the leader of the program will meet individually one-on-one with each participant closer to the last third of the program session. And you work with them to set individualized goals on what they're going to do to continue being physically active once the program is over. And this just really helps the individuals continue their exercise routine and they don't just fall off the wagon, which can commonly happen when you complete a program. So for both Walk with Ease and Fit and Strong, they both include a leader guidebook. So they both have scripts. So I mentioned how you would talk on health education topics. Both of these books have a script that you follow. So it's not that you are expected to go do homework and write about what you're going to talk about that day. It's all listed out in your book for you. And both programs also have a book for the participant to be able to utilize. And because of COVID, both of these program opportunities also have virtual workshop opportunities. And those will continue on even after we're able to do an abundance of in-person programming. It can really be up to the instructor whether they want to do virtual delivery or in-person delivery of these programs. All right, the next 2 programs, we'll start with the Growing Healthy Families and Communities track. So volunteers of this track will use evidence-based scripted lesson plans provided by the state office as a part of this community track. As the curriculum is evidence-based, it is intended to be used as a script for the volunteer in order to create the largest impact on behavior change. The target audience of this program track is limited resource audiences who qualify for food assistance programs. So this track does have a very specific target audience, whereas most of the other tracks are pretty open. For Money Mentor, the Money Mentor program will develop volunteers to provide personal finance education to South Dakotans. Volunteers will be trained to implement the Your Money, Your Goals toolkit, which was developed by the Consumer Finance Protection Bureau. The toolkit provides valuable knowledge to help consumers increase their skills and confidence in making important financial decisions necessary to meet their goals. Once you are trained as a money mentor, you will collaborate with organizations and community groups to provide either group or one-on-one financial education to individuals who are interested in solving a financial problem or gaining more knowledge related to their financial situation. All right, and then Better Choices, Better Health. This is the last program track opportunity under the Master Health Volunteer umbrella. And this is South Dakota's suite of evidence-based chronic disease self-management education programs. It was developed by Stanford University, offered through the Self-Management Resource Center, and licensed by SDSU Extension. Better Choices, Better Health South Dakota workshops are designed to provide skills and tools to help adults living with ongoing physical and/or mental health conditions and caregivers to increase their self-confidence in managing either their or a loved one's health conditions. Better Choices, Better Health South Dakota workshops are offered in several different formats. So first, there's in-person workshops. Then they can also be offered over Zoom. So all the participants join Zoom and participate in the workshop that way. Or the participant can be mailed a toolkit, and then there can be weekly conference calls with the leader. In the training to become a Better Choices, Better Health leader, you learn how to co-facilitate these chronic disease self-management education workshops, follow a specific process, and the scripted curriculum. For this program track, workshops consist of 6 weekly sessions. All of them are 2.5 hours each and are always co-facilitated by 2 trained leaders. It is beneficial if the applicant is living with a chronic physical and/or mental health condition or has cared for somebody who has a chronic health condition. These workshops are available to support South Dakota adults on their journey to better health, and the different program offerings include, and these are also listed on the slide, the chronic disease self-management, which is for adults with any chronic mental and/or physical health conditions, the diabetes self-management program, which is for adults with prediabetes or type 2 diabetes, chronic pain self-management, which is for adults with chronic pain persisting for 3 months or longer and having it affect their quality of life. There's cancer, which is for adults with cancer and cancer survivors. And then lastly, there is Worksite, which is offered by employers to their employees in a model that is designed specifically to help employees find a work-life balance and be more productive.
Now we're going to take a look at the program structure of the Master Health Volunteer Program and how a Master Volunteer Program is different than a general volunteer program. Many people have volunteered in their life, and I'm sure most of you on this call have volunteered at least once in your life. Volunteers have received a brief training in the subject, but the training is rarely in depth. A volunteer normally doesn't make a formal commitment to serve. They don't have a specific title, and they are not necessarily recognized as a knowledgeable source in the subject matter. On the other hand, we have a master volunteer who is selected based on their skills and experience. An interview may have been conducted or a brief explanation of their qualifications. The master volunteer receives an in-depth training about the subject and learns new skills along the way. They may make a written commitment to give back a specific amount of time and is recognized as a trained professional aide. Following the in-depth training and becoming a master volunteer, the next step is to become a certified master volunteer. To be a certified master volunteer, the individual needs to complete 40 hours of service relevant to their training within 12 months. Once the 40 hours are achieved, they are recognized as a master of the subject, have received certification from SDSU Extension, and have a name tag verifying program completion. To maintain certification, the individual must complete 20 give back volunteer hours and 10 hours of continuing education each following year.
So to bring all of that together that Cheyenne just touched on, here is a representation of the training and certification process on becoming a master health volunteer. So you'll see that step 1 is completing the 40 hours of online training. So you get access to this online training after applying and being accepted as a Master Health Volunteer. First, you'll go through general education content to help grow you as a volunteer. So this content may include information related to a background of SDSU Extension, covering civil rights, leadership, active listening, culture and diversity, and chronic diseases, just to list a few. Once that 40 hours of general education is completed, you will go through so I kind of misspoke a little bit. So within the 40 hours, after you complete that general education, you then go through the training process for the track that you select. So if it's Better Choices, Better Health, Fit and Strong, or Growing Healthy Families and Communities. Once you finish that training, that is the end of your 40 hours of training. So you have 40 hours of training total. And then from the date that you finish your 40 hours of training, it begins your 12 months of being a Master Health Volunteer intern. So to move from this intern status to the certified Master Health Volunteer status, you need to complete the 40 hours of give back service that's related to the track that you were trained in. And then in order to maintain your certification level, you must complete 20 hours of give back service and 10 hours of continuing education each year.
Here is a list of benefits of volunteering. So increased well-being, build your resume, learn new skills, decrease depression, a sense of purpose, increase life satisfaction.
All right, and then who can become a Master Health Volunteer? It really can be anybody that has an interest in health and wellness and anyone that just wants to give back to their community. So there is no previous health experience that's required. Everyone who wants to improve knowledge about various health topics and then share that knowledge with your community. The only necessary component is that the individual must reside in South Dakota and provide programming in South Dakota and must be at least 18 years of age. So we do have some volunteers who are already trained in Better Choices, Better Health or Fit and Strong, but they're not known as a Master Health Volunteer. But I did get a quote from one of our Fit and Strong volunteers, just because I thought it would be really nice to share the impact. Sorry about that, everybody. I thought it would be nice to share the impact and experience of this volunteer. Cheyenne, would you want to read this slide for me?
So Jean Mitchell, Fit and Strong program volunteer, said, SDSU Extension has proved to be an invaluable resource to the Fulton Area Medical Center. We were able to offer evidence-based exercise groups to our patrons at no cost to our affiliation with SDSU Extension. It is very difficult to provide these classes in rural areas due to startup costs and finding qualified leaders. By volunteering with SDSU Extension, I was provided the resources and leadership and assistance with marketing and registration to make these things happen from my community.
Okay, so the next slide we have here is just saying why volunteer with us. So SDSU Extension uses evidence-based research and best practices to inform our community engagement efforts. We center our work on educational outreach and health expertise, and we really strive to make scientific knowledge understandable and accessible to all, and to inspire and encourage lifelong learning through continued scientific exploration and discovery. We have worked for years in establishing partnerships with many communities, and it is through their needs that really drive our work. We are empowered to create change in communities through these through this educational engagement in alignment with our program priorities. And in addition, we are connected to people and committed to learning, becoming leaders in our communities, and contributing to improve South Dakotans' lives. We collaborate and work across geographical and organizational boundaries to create viable and vibrant results. So now we've kind of wrapped up all of the details on the Master Health Volunteer Program that we wanted to cover here with you today. This is the point where we invite you to put your questions in the chat box, and we just want to let you know how you can apply. So once you kind of know what tracks interest you, you can submit your interest on our webpage. And I know some of you have already done that, and that's wonderful. We'll also drop this link in the chat box for you just to make it more convenient for you to access it. And then once you submit your interest, you will get emailed an application form. And I'm actually going to just automatically send out that application form following this webinar. So you all will receive it. Of course, take your time to think about the program more and what tracks might interest you, and just send me an email if you have any other specific questions, or even if you want to meet to discuss the program a little bit further. But as I said, at this point in time, we'll go ahead and take any questions.
There's one question from Colleen in the chat box asking, how does one get a group going in the community?
Yeah, that's a great question, Colleen. And I'm going to answer it in two parts because I feel like you could be asking it two different ways. I think I know which way you're asking it, but I'm going to answer it both ways because this was something that I wanted to cover and failed to. So as I mentioned, we already have some volunteers that are trained in Walk with Ease or Fit and Strong or Better Choices, Better Health. So for Better Choices, Better Health, for example, you have to have 2 co-facilitators, like I mentioned, and say that you're from a community and you're the only one that you know of that's trained. We do have a network of other volunteers all across the state that we can hook you up with so you can co-facilitate together. If you're doing like a virtual delivery of any of the programs, it's obviously a lot easier to hook you up with a current volunteer to teach them together. But that's always something that we're able to help you with just with our current network of volunteers. If your question was how do you get a group going as far as how do you recruit participants, we help you with that marketing. We have flyers and Facebook posts and brochures and posters that are already developed. That is something that we like to help you with. So we have templates that will be accessible to you once you are a Master Health Volunteer intern. And then you can just plug in your information, such as the location, the days, and the times. And then we always encourage you to hang up flyers in your community, do some community outreach. And then we also help on our end too of maybe sending it out to a listserv of individuals that have expressed interest in the past. So for example, we do have a wait list of individuals who are interested in a specific program, but perhaps now wasn't the time because they don't want to do virtual, which is just fine. Or maybe they're interested because they've heard of the program that's taking place in Sioux Falls, but they live in Watertown, so that wouldn't work. So we do put them on a wait list and then have the note that this individual is in Sioux Falls. So we do have a list of potential participants to help you with as well. Is there a minimum number of people for a group? And is there a fee to use a facility for an in-person? Okay, so for the minimum number of people for a group, for the Money Mentor program, there is not, as I kind of mentioned when I introduced that can be done one-on-one. For growing healthy families and communities, I feel like that can be done one-on-one as well. However, I am not the program lead for that track, so I can't tell you that with 100% certainty. With Walk with Ease, I know the minimum is 5 for in-person. For Fit and Strong, the minimum is, I think it's 8 for in-person. I'm a little rusty because we haven't done in-person programming for about a year. For the virtual delivery of Fit and Strong, we've put a minimum at 5 just to make it worth the instructor's time. And then for Better Choices, Better Health, I believe that's either 5 or 8. Again, I'm not the program lead on that one, so I can't tell you that with 100% certainty, and I am sorry about that. Okay, Lisa asked for growing healthy families and communities. You mentioned that SNAP participants is the targeted audience. Can you help others as well? That's a really great question. I'm going to answer this to the best of my knowledge. So, for that track, like I said, the target audience is those that are low resource audience. I believe as long as a certain percentage of your audience qualifies, then you're able to do that program. I just can't remember if it's like 50%. I can't remember the exact percentage, but you are able to have individuals from outside of your target audience that are also a part of your workshop. Okay. I think I
I
missed
asked a
a
question at the top. So the training I had for Fit and Strong plus BCBH was over 12 months ago, but things were put on hold due to COVID. I didn't do anything as I was dealing with my husband's cancer. Does that affect my ability for becoming a master?
Yes, great question, Jen. And you're not the only current volunteer that has asked that question. So, what that would look like for you, as long as you still have your certification with BCBH, because I know that you still have your certification with Fit and Strong, you would have to go through the general education portion of the training, but it's not that you would have to redo your Better Choices, Better Health or Fit and Strong training. So, it would be estimated somewhere between 10 and 12 hours of that general education that you can do online at your own pace. Once you complete that, you would be known as a Master Health Volunteer intern until you completed the 40 hours of volunteer service. Let me know if that makes sense, Jen.
Cortez asks, will volunteer opportunities be something that we have to actively seek out and create in the community, or will SDSU Extension create these, maybe a mixture of these?
Yeah, Cortez, you're exactly right. It would be a mixture. What we try to do is kind of plan out, I don't want to say our program year, but kind of our program year and targeting like, let's say for Walk with Ease, because I'm a coordinator of that program, so I can answer it easier. But for Walk with Ease, we try to plan out all of our workshops for 2021, January through December. And then when we talk with our volunteers, we tell them this is kind of when we're thinking we want workshops done. Does somebody want to like sign up for a specific workshop? Or you also can be like, I have a lot of individuals in my community that are really interested. And I want to just kind of launch my own workshop, which is great. And then we'll just work side by side with you to get registration and all of that going.
Another question is, can we be notified of what programs/areas are lacking volunteers? I would like to volunteer for a program or track that is underrepresented.
Wow, I love that. That is great. Since we just launched this program, we've been holding interviews and received a lot of applications, but we currently don't have a track that's like, oh, we have a lot in this area or a lot in that one. From what I am aware of, we do have good interest in Walk with Ease, Fit and Strong, and Better Choices, Better Health. So the Money Mentor track or the Growing Healthy Families and Communities track might be one that has a little bit less interest. Growing Healthy Families and Communities is not available until the fall. So that one is still kind of being built up. So we're kind of putting together a wait list for that one. And I know for Money Mentors, that one you'd be able to get access to right away. And they do have an in-person training in June. So you would have to be able to travel for an in-person training. I think she said it would be a 6 to 8 hour training. Do you provide a facility for a group to walk during bad weather? Yes, we do. So commonly the most participation we tend to have with our physical activity programs is during the winter months because everyone is eager to be able to get out of the house and be active. So typically how we have set it up is that we plan to be in a facility. And then when there are days where it is nice, or if your program's running into spring and there's a nice spring day, we do tell our participants, hey, we can go outside and walk today. There are some participants that have not been comfortable going outside. They have concerns about, uneven sidewalks or getting injured, rolling an ankle. So we've had some individuals that have preferred to stay inside. So in this specific instance, we did have two leaders of the program. So one leader stayed in and walked with the participants that wanted to stay in. And then the other leader was able to go outside and walk outside with the other participants, because you clearly don't want to leave your participants left unsupervised. And we're happy to work with you, Roberta, on where you're located and brainstorming a facility. And depending on your location, perhaps we already have a partnership established that we know that you could program at. So you're never left on your own with either recruiting participants, finding a facility, or any of those details, or even registration. We are always there to help you along the way.
A couple people asked about the cost of the training and if there's any cost for the participants.
Yes, thank you, Cheyenne. So to become a Master Health Volunteer, there is a $50 charge, so 50, and that's a one-time charge just to get you access to that online coursework. There's not like a renewal fee each year, it's just the flat out $50, and then that is it. For our participants, I know I can answer on the Better Choices, Better Health Walk with Ease and Fit and Strong side, there is no charge for them. For Money Mentor and for Growing Healthy Families and Community, well, actually for Growing Healthy Families and Communities, there is no charge as well. And I believe that is the same for Money Mentors. Really good questions so far. And just another thing, just because I keep mentioning how I don't know everything about the other programs, we do have 3 different program leads. So I am the program lead for the Walk with Ease and Fit and Strong track. And then we have our registered dietitian, nutrition field specialist, Megan Jacobson, who is the lead for the Better Choices, Better Health track. Lorna Sabo Wounded Head is our financial family resource management field specialist, and she is the program lead for Money Mentor. And then we have Kimberly Cripps, who is the program lead for Growing Healthy Families and Communities. So when you submit your application and you indicate what tracks you're interested in, we do our best that if you're interested in Money Mentor and Growing Healthy Families and Communities, to set up an interview where both Kim and Lorna can be present so that you all can talk, you all can meet, they can tell you further details about their program and let you know any specifics that you want to know so that you can make the decision that is best for you. All right, do we have any other questions? Okay, it looks like we maybe have got them all, and I don't see any new ones coming in. So as you, oh, hang on a second. Yes, the Growing Healthy Families and Communities training, that is going to take place in the fall. So we have about half of the training for that track done. It's just not fully complete yet. So Lisa, if that's the track that you feel most passionate about, I do encourage you to apply so then we can get an interview scheduled, and then if that goes well, then you can be on the list for that. And it would just be that you need to know that that's not going to be ready to be completely finished until this fall. You're welcome.
One person asked, are you putting application on chat? Hope mentioned that she will be putting, emailing all of you afterwards, sending it through that.
Yes, that is a great question. It's a Word document, so that's why I'm going to be emailing it to you. And I'm seeing that we're having somebody raise their hand. I don't know if participants can unmute and ask a question. You're definitely welcome to if you can. Otherwise, drop it in the chat box or in the Q&A box. All right, Cortez says, speaking from a place of experience, what is the mental health benefit you get from doing this? Also seeing people grow and succeed. Can you share a little bit about this? Yeah, I think it's huge. It makes me kind of want to go back to the slide that Cheyenne touched on of just all of the benefits. And Cheyenne, I'm going to put you on the spot a little bit, and then I'm happy to jump in. But I know you had kind of started an article on the benefits of volunteering, so you might have a better experience of explaining this than I do.
Rereading the question quick. Mental health benefit for me, I'm going to speak from experience. So I find that I am so much happier when I volunteer. I feel like I'm giving a piece of myself and allowing to help others. So decrease depression, I've noticed. It helps with stress, lower stress. I feel like I'm helping with I have a sense of purpose and just a life satisfaction overall.
Thank you, Cheyenne. Yeah, and Cortez, with you saying like seeing people grow and succeed, I just think that in itself is so rewarding to anybody, just seeing the impact that you have on somebody else and how it affects them in their life. And being able to hear their success stories that they've had. I know with the programs that I lead, it's so rewarding. You know, we have a lot of participants. We have 4 different Fit and Strong workshops that are happening right now, currently. And recently I talked to one of the participants and they were just saying like the other day I dropped something and I bent down to pick it up. And after I picked it up, I was like, oh my gosh, I was able to like bend down and pick this item off the floor. Whereas before he didn't have the balance or the strength to be able to do that. So to him, like that was just an amazing experience for him to realize the strength that he had gained from the Fit and Strong program. Okay. Well, it looks like we have all of the questions answered. So thank you for joining today's webinar. I'll put our contact information slide up again in case you wanted to, jot anything down. But again, I have all of your emails since you signed up for the webinar. And I'll be emailing out a little bit more information, just kind of a summary of each of the programs and then the application form as well. And then I'll put in the link to the interest form too. So thank you, everybody. We're so glad that you are here and we're excited about your interest in this program.
Thank you, everyone.